Okay, let's start. Thanks very much, Linda. Okay, welcome everyone to Healthy Aging Policy Research Unit webinar on Can AI Deliver for Policy Research? This is a part of the series of webinars by the NIHR Research Unit in Healthy Aging, but this one's in collaboration with the NIHR Innovation Observatory and the National Centre of Implementation Science in Australia. So welcome to today. A few housekeeping things first. For information, this webinar is going to be recorded and the video will be put onto our YouTube channel. And it will be sent out to everyone who's registered if they want to look at it later time. Throughout the webinar, we'll be able to post links about any related research into the chat as we go on, so that there'll be references and things that popped into the chat. At the end of all three presentations, we will pause and give an opportunity for questions. Now then, on your browser, you should be able to see both a chat and a Q&A option. Not all the browsers support both. So if you can't use Q&A, use chat. And we also know that sometimes the firewalls of different institutions make the Q&A inaccessible, or maybe even make the chat inaccessible. Normally the chat works. But as a default, use the chat. As a default, use the Q&A. But if you can't use Q&A, use the chat. What we'll do is we'll then bring those questions forward to be discussed at the end of the webinar. Right, so we have three speakers today, and we're going to be discussing how AI tools can help with research policy tasks, such as reviewing the evidence, analysing documents, extracting data. We're going to be looking at three studies which have looked at AI versus or with humans. Now, the three talks are, first, Gemma Spears, who is a Principal Research Associate at Newcastle University and part of the Healthy Aging Policy Research Unit. She's going to be talking about how can AI support responsive and rapid policy research. Then we'll turn to Sahila Ghazvi, who is from the Innovation Centre, and she'll be talking about assessing the validity and utility of LLM-supported qualitative analysis of statutory policy documents. Finally, we'll turn to Daniel Lee from the University of Newcastle. And notice, not Newcastle University, the University of Newcastle in New South Wales. So all of them are from Newcastle, but two different Newcastles. So in AI, he'll be talking about, is AI-assisted data extraction as good as humans? So, without any further ado, I think I'll turn over to our three speakers and ask Gemma if she will start sharing slides. Thank you very much, Gemma, and the floor is yours.
Thank you, Chris. Hi everyone, I'm Gemma and I'm going to share our experience of using Elicit, which is an AI systematic review tool. So I work in the Healthy Aging Policy Research Unit, and a large part of our work is doing systematic reviews to provide evidence to policymakers. It's rare that we do those long, full systematic reviews, the type that Cochrane would do, because often we're working with tight, opportunistic policy windows. So we may have anywhere between 4 weeks and 4 months to complete a review. And because of this, we use rapid review methods, which are a streamlined version of systematic review methods. So last year, we came across this AI review software called Elicit, and Elicit claims to be able to complete systematic reviews very quickly, which sounds great. But the important question is, does it produce a review that's reliable, robust, and gives an unbiased picture of the evidence? So we decided to test this using one of our recently completed reviews. So it's this review cited at the top by our colleague, led by our colleague Lisa McGarrigle. And the review was looking at the effectiveness of interventions to improve physical activity in disadvantaged groups. Now, the reviews that we do in the Healthy Aging Policy Research Unit are often complex, and by that I mean they cover a wide range of outcomes, a number of complex interventions, and they often look at not just whether an intervention is effective, but whether it's effective across population strata as a way to explore intervention equity. So this would involve looking for outcome data stratified by, for example, socioeconomic status. So we wanted to test Elicit using one of these complex reviews, and we used this one by McGarrigle et al. So we mimicked this review in Elicit, and we did this by inputting the review question and the detailed review criteria into Elicit, and then we assessed how Elicit performed at each step of the review using an a priori evaluation framework. We didn't assess risk of bias because this function wasn't available in the version of Elicit that we evaluated in November 2025. So starting with the searches, the sources used by Elicit were OpenAlex, Semantic Scholar, PubMed, and clinicaltrials.gov, with the same strategy applied to all. 500 documents were identified by the search, but it was unclear how these 500 records were selected. We wondered whether the selection might be patterned by the date of publication, but when we checked this, there was a roughly even spread of publication dates across the 10-year period specified. And for comparison, when we did the review, we searched 3 bibliographic databases and got just over 6,000 records. So of these 500 records, Elicit judged that around half of these were eligible according to the criteria that we specified. So the eligibility decision is based on a score out of 5, and the 243 eligible studies scored at least 3.9. So from the 243 eligible studies, the synthesis and report that Elicit produces is based on the 40 publications that have the highest screening scores. But an issue that we found here was that on closer inspection, some of the included and excluded studies had the same screening scores, and we couldn't quite figure out how Elicit had decided to include some studies but not others where they had that same screening score. So Elicit included 40 studies in the synthesis and report, which is the maximum in that version that we evaluated. Of these 40 studies, 4 were eligible on our criteria. We went through all the studies, we checked their eligibility, 4 were eligible and 36 were not eligible. So this table here summarises the reasons why those studies weren't eligible, and a number of studies were not eligible on a number of reasons, which is why these figures don't sum to 36. The most common reason that a study wasn't eligible was because it didn't evaluate an intervention in an eligible Progress Plus population, or it didn't stratify outcome data by an eligible Progress Plus population. And we did specify all of the eligible Progress Plus populations in the criteria that we gave to Elicit. By comparison, the human review included 47 studies, and of these, 3 were in the Elicit report. Of the remaining 44 eligible studies that we found, 9 were considered ineligible by Elicit, 1 was considered eligible but not included in the report, and 34 were not retrieved by Elicit searches. Now, we did try to unpick why those 34 studies were not retrieved by Elicit searches, but this remains a bit of a conundrum because most of those 34 studies, when we checked, they were indexed in the sources that were used by Elicit. So in terms of data extraction, Elicit produced a summary study characteristics file, and this was well detailed and it could be easily exported. So that's a positive. There was also an Excel file of outcome data, but the completeness of this data and the clarity was variable. So effect estimates were extracted for some but not all studies. There was also a field in the Excel file that pinpoints an associated data table in the publication for the outcome data, but these fields weren't complete for every study. And it wasn't clear if the absence of data in the data file meant that there was no associated data reported in the publication. We didn't check the data extraction for accuracy because this was beyond the scope of this evaluation, but we are aware of other evaluations of Elicit that say that it performs quite well on data extraction in terms of the accuracy. And then from all of this, Elicit produced a report. So the report was wide-ranging, but much of the generated content didn't answer the review question, which was most likely due to the inclusion of a lot of ineligible studies. And in the version that we evaluated, the claims weren't cited, but we are aware that this has now changed in Elicit, so that's good. There were a number of tables in the report, but the outcome data tables didn't include data from all the studies, and again, it just wasn't clear why. But the summary study characteristics table was detailed and clear and helpful. So most researchers recognise that feeling that you get when you've completed a project, you've finalised the report, you've checked a box and you feel good, you've achieved something. So in December last year, we were finalising the report, and then Elicit issued 2 critical updates to its software that had implications for our evaluation. So the first update was the use of strict criteria, and this means that ensuring only studies that meet all of the criteria are included. So we think that this probably would have removed all of that irrelevant material that was included in the report in our evaluation. This new function would be unlikely to impact the omission of the eligible material because this seemed to be mostly about the searches not retrieving 34 eligible studies. The second update was increasing the maximum number of studies in the report from 40 to 80. So this made us question, well, would this make a difference to the number of eligible studies included? So we reran the Elicit review, kept everything the same. We didn't change the strictness criteria. We just wanted to see whether an 80 study report would produce something different. So in the 80 study version, Elicit did include an additional 3 studies. It didn't include the 34 that weren't identified by the searchers. That was to be expected. So although it did increase the number of eligible studies, it still used 80 studies, the maximum. So it also included a lot more ineligible material. And then a bit later, Elicit added the citation function, which is good because this enhances the transparency and the traceability of claims in the report. So our takeaway reflections from this experience are first that in the version that we evaluated, Elicit didn't seem capable of fully replacing researcher-led reviews to achieve the same robust outputs. The key concerns for us were around the adequacy of the searches which didn't retrieve important material and the transparency around the decision-making using the eligibility criteria. Now, we did this test with a complicated review, and we did that on purpose because most of our reviews are complicated. And if we're going to use Elicit, we need to see how it fares in that respect. We think that if we had given Elicit a more straightforward topic, it probably would have done a lot better. So we think, going forward, if we are going to use AI in evidence synthesis, which is in all likelihood what's going to happen, AI does need to be able to respond to those complex review questions. And our final reflection, and I guess our final takeaway, is that we see a lot of potential with Elicit. There were hiccups. It didn't do everything perfectly. But one way we might use it, for example, might be we do the searches, we do the screening, and then we give Elicit our eligible studies and get it to do a very quick extraction and synthesis. Now, this would require researcher input to check accuracy, but we think this is probably how the AI interface is going to work in evidence synthesis. It's not something that can be used in isolation on its own. It needs researchers to input into it and to work with it. And with Elicit, you do have the option of overriding its functions. Obviously, this brings the question of what is the time-saving element if researchers are working with AI software, but that's something to explore going forward. So I guess in a nutshell, there were some hiccups with Elicit, but we're not ruling it out and we see some potential. The paper is currently under review, but if you have any questions in the meantime, please feel free to get in touch. Thank you.
Thanks very much for keeping so close to time, Gemma. Well done. Thank you. Very interesting. We will take questions at the end. I think it'd be better to have all the questions together. So could I encourage people to put questions into the Q&A or into the chat? And now we'll turn to Sahila. If you would like to share your screen as well, Sahila, and put your presentation up.
Yes, of course. Thank you, Chris.
Yes, we can see that if you go to presenter mode. Thank you, that looks good.
Thanks, Chris. Good afternoon, everyone. It's a great pleasure to be here today and to share an overview of this study on behalf of our team at the NIHR Innovation Observatory. The study explored the use of large language models for qualitative data extraction from statutory policy documents. I'm going to briefly take you through our methods, findings, and some practical lessons we learned from this study for anyone interested in using these tools in qualitative policy research. So to give a bit of context, I think this study emerged from a practical challenge that many of us are now facing in applied health research. How can we manage the growing volume and complexity of health policy documents within limited time while still maintaining rigorous qualitative analysis? And at the same time, there's a growing interest in using generative AI and large language models in research. And in some cases, general purpose large language model tools, either free versions or subscription tiers, are adopted based on positive experience shared by colleagues, sometimes without systematic testing of their reliability for the specific research task. And despite this growing interest in testing large language model tools, we've got a limited empirical evidence on their performance in analyzing statutory policy documents. So in this study, we aim to compare qualitative data extraction from ICB joint forward plans by researchers and 3 subscription tier large language models. So we chose ChatGPT 5.2, Grok 4, and Claude 4.5, which were the latest model available at the time of this study. So the aim was to assess their accuracy, their traceability to the original document, and also to understand the practical utility for this tool in qualitative policy research. In terms of the method we used a deductive approach for our data collection. So rather than starting with open-ended coding, we began with a predefined analytical framework, which guided our data extraction by specifying the types of data we aim to collect. And in terms of sample, we selected 5 JFPs from ICB's serving population with high socioeconomic deprivation areas, as we expected these settings to more visibly reflect challenges related to inequality, access, and complex health needs. For manual extraction, 2 researchers independently extracted the data using the analytical framework. We then compared our extraction assessed intercodant reliability on 20% of the data, and any disagreement above 20% triggered the full data review for us. For the automated data extraction, the same framework was used alongside a set of prompts developed using the RACE approach. And for those who are less familiar with this approach, it stands for Role, Action, Context, and Execution. So you're going to tell the model what role or perspective to adopt. You specify the task the model should perform, and you provide background information like source material or constraints. And in terms of the execution, you're going to explain the desired output format, level of detail, and any rules to follow. So I need to add that we use the same prompt structure across all 3 tools because the aim was to compare model outputs under a sort of standardized condition to minimize variability introduced by any model-specific prompt optimization. And here is this slide is summarizing the predefined framework we developed for this study. The framework was designed to help us understand and compare health and care priorities across ICB landscape in a consistent way. And it was a policy-informed framework, including the NHS long-term plan, Core 20+5, and ICB operational guidance. The framework, as you can see, covered 9 domains, which were translated into 41 analytical questions, capturing key areas of health and care planning across ICBs. So some of our domains, some of the domains we developed focus on highly operational content, such as KPIs, delivery plans, and systems capability, while others more focused on narrative and process-oriented material, such as public engagement or regional variation. So in terms of the decision we made in our comparison, we developed structured decision categories. We had agreement, refer to cases where researchers and the LLM identified comparable evidence. We had partial agreement, which used where one source identified greater relevant detail than the other. And we also had disagreement, refer to cases where only one source identified relevant evidence. And both partial agreement and disagreement could occur either in favor of manual extraction or in favor of the LLM. So here is an overview of the results. So the first major finding was speed. So the LLMs completed data extraction in approximately 5 to 7 minutes per document, while it took us as human researchers approximately 6 hours per document. So from a feasibility perspective, the efficiency gains were substantial. Looking more closely at the decision categories, we can see some important differences between the models. So Grok showed the highest direct agreement with the manual extraction at around 60%, suggesting the closest alignment with the researcher-led approach. And then we had ChatGPT, which had the lowest direct agreement and at 25%, but the highest disagreement in favor of the LLM at 18%, which means it was more likely to identify relevant content not captured in the manual extraction. And then Claude, by contrast, showed the highest partial agreement and disagreement in favor of manual extraction, which suggests that researchers more often identify additional details or evidence that Claude did not capture. So the domain level findings were particularly interesting. As you can see, Grok performed, I've highlighted those domains that Grok performed better. So Grok performed strongly in domains containing more structured and operational content, such as cross-cutting system capabilities, use of data and evidence, and cross-ICP comparison. And these areas often contain explicit targets, governance structures, metrics, and operational reporting. And then we've got ChatGPT and Claude here. So ChatGPT performed relatively better where priorities and KPI were clearly signposted in the documents, and Claude showed comparatively stronger performance in more narrative and engagement-oriented domains. So I want to leave you with a few reflections from this study, a few lessons we learned by doing this study. So first of all, I think the model choice, we learned that the model choice matters, and we find that performance varied across the models and across different types of policy content, and some models aligned more closely with manual extraction, while others identify additional information or missed key details. This means choosing an LLM should not be seen as a purely technical decision, and it should be guided by the type of task, the type of data, and other practical considerations such as ethical consideration, organization access, institutional approval, transparency of the model, and data security. One of the clearest lessons from this work was also that prompts are not just instructions, they are part of the method itself, and any small changes in wording or structure can influence what the model can extract, and therefore it's going to impact on the quality and consistency of your output. So it means that prompts should be tested and they should be refined and documented and standardized in the same way that we would approach other research methods. And last but not least is that more extracted data does not necessarily mean better extraction. In some cases, the LLMs identify additional content beyond the manual data extraction, but that does not automatically make the output more analytically useful. So researchers need to decide what is relevant, what's accurate, and what's meaningful for their research purpose and their analysis. If you're interested in learning more about this study, here is a QR code and link to our paper, which is currently under review, and we hope that it will be published soon. Thank you very much for listening. I'm going to stop sharing.
Again, thank you very much, Ela, for keeping so closely to time. Right, so now we turn to Daniel, who's going to be telling us about, is AI-assisted data extraction as good as humans? So, continuation of the themes that we've been discussing. Thank you very much, Daniel, and it looks good as if you're sharing screen, so over to you.
Thank you, Chris. Hi, everyone. It is a great privilege to be here today. And on behalf of my research team, I'll be presenting the findings from our non-inferiority study on whether AI, specifically Elicit, which was what Gemma evaluated as well, but whether it is good as humans in extracting data for systematic reviews. So a bit of background, we know that systematic reviews are critical for informing public health policies, but they are substantial undertakings. AI tools have been effective in supporting various steps of the review process, such as in conducting searches and screening, but evidence for their use in data extraction remains limited. Data extraction is a major time and resource burden in systematic reviews. A single reviewer takes anywhere from 38 to 107 minutes per study, and while following best practice with 2 independent reviewers plus consolidation, brings that to about 172 minutes per study. And so for a review with just 15 studies, it would take 43 hours or approximately 1 week worth of work just for data extraction. Given this burden, emerging AI tools for data extraction is a promising solution to improve the efficiency of data extraction while maintaining the required accuracy. One AI tool that is increasingly being evaluated by researchers is Elicit, because it is specifically designed to accelerate the evidence synthesis process. Existing research on the use of Elicit for data extraction has found that Elicit only, with no human involvement, is capable of achieving high accuracy, ranging from 77 to 100%, compared with human-only extraction. However, these evaluations remain limited, as they have only assessed a small number of variables, of up to 10 variables. There were also a limited number of robust studies that have evaluated Elicit for data extraction, and of the studies that did, they only assessed the use of Elicit by itself and not as an assistant to humans. Furthermore, no study has examined whether the types and severity of errors made differs between Elicit and human extraction. And therefore, a comprehensive evaluation is needed to assess Elicit's performance as an AI-assisted extractor. Specifically, the aims of this study were to determine whether AI-assisted data extraction is non-inferior to human-only extraction in terms of accuracy and time to complete, to explore subgroup differences by data group and data type, and to compare error types, severity, and costs between both approaches. So how does it work? On the screen, you can see a screenshot of Elicit when using it for data extraction. And once you have uploaded the PDF, Elicit uses large language models to read PDFs and populate the table. And as you can see here, on the leftmost column, it shows the individual studies. You can then add new columns to extract specific variables, some of which are predefined by Elicit, or alternatively, you can actually customize it by yourself. This study is a 2-arm non-inferiority study within a systematic review, which is a relatively new design that has been recommended as a method to evaluate AI tools. The participants were 2 research assistants, and as you can see in the figure on the right, from a list of eligible studies, we randomly selected 50 to be allocated to both arms, and the participants were then randomly allocated 25 studies from each arm. In terms of outcome measures, the non-inferiority margin was set at less than 10% difference between the 2 arms for accuracy and time to complete, which is equivalent to about 5 to 10 points difference. Accuracy was assessed using a 3-point rubric by a blinded independent assessor, and we also conducted subgroup analysis by data group and data type. Time to complete was self-reported by the participants, and inclusive of time taken for preparation, which included all the things required for the setup of the study, as well as the time it took for data extraction. And we also ran a sensitivity analysis for the time to complete, where we excluded the preparation time to account for the one-off setup. Errors were coded by types and severity and by study author, and the costs were calculated inclusive of the subscription for Elicit, the preparation time, and the extraction time. And so here are the results. This graph here shows the mean difference in accuracy between both arms, with the right favoring the AI-assisted arm and the left favoring the human-only arm. And on the y-axis, you can see the accuracy for overall, by data group, and by data type. For overall accuracy, there was no significant difference, and the data were within the non-inferiority margins. So it just means that they both perform similar to each other. This meant that, for subgroup differences by data group, we also found no differences, except for intervention and control group, where we found it favored the AI-assisted arm. And we also looked at subgroup differences by data type, but again, no differences. Moving on to efficiency, we found that the AI-assisted arm was more efficient than the human-only arm. The left chart shows that the AI-assisted arm completed extraction an average of 25 minutes per study faster than the human-only arm. And in terms of non-inferiority, the results were outside the 10% difference, but it was in favor of the AI-assisted arm. And so while we cannot conclude superiority, we can say that it is significantly faster than the human-only arm. The chart on the right shows the sensitivity analysis, which excluded preparation time, and found that the AI-assisted arm completed extraction an average of 40 minutes faster per study. This slide presents two things, the types and the severity of errors made by each arm and the cost differences between them. Looking at the table on the left first, we found that the difference in the error types, as you can see there, are similar between both arms. The differences ranged from 0 to 2.4%. And similarly for severity, at major, minor, and inconsequential, the differences were also small, ranging from 1 to 1.9%. Now, looking at the chart on the right, the AI-assisted arm cost 182 Aussie dollars less than the human-only arm, which is about 97 pounds. So not much, but still cheaper. So to summarize, is AI as good as humans at extracting data? Yes, we found that AI-assisted data extraction using Elicit showed non-inferior accuracy, faster completion time, similar error types and severity, and lower costs compared to human-only extraction. But what does this mean? Well, these efficiency gains without the loss in accuracy suggest that AI-assisted extraction could reduce reviewer burden in future systematic reviews by replacing one of the two human extractors. And in the future, we should explore different AI-supported extraction workflows, such as 2 AI-assisted extractors or 1 AI-only extractor and a human-only extractor. Now, there's still a lot more research that needs to be done to validate, to confirm, and to test newer versions, but these are really promising findings. Before I wrap up, I just want to take a moment to acknowledge the research team, because this was truly a collaborative effort with team members across different countries contributing to various parts of this study, and I'm really proud of what we achieved together. I'm also personally grateful for the opportunity to work with such a wonderful team, as this actually formed part of my PhD. And I especially like to thank my primary supervisor, Rebecca Hodder and Kate O'Brien, who were instrumental to this work. Our funding sources and acknowledgements are listed on the slide. Thank you for listening, and I hope this gave you a useful insight into the potential of AI-assisted data extraction. If you like to read more, the QR code is on the slide, and I think for our preprint, and I believe that there might be a link as well in the chat. Thank you.
Thanks very much, Daniel. Thank you. So there's been quite a lot of chat going on in the chat, and there's a few questions in the Q&A. So what I'll do is I'll have a look at the Q&A first, because quite a lot of the chat, Gemma's actually sort of responded to people as we went along and answered their questions. And so I think you can probably all see the chat. And therefore, maybe just repeating what was said might not be the best use of time. But Louise Scott's asked a rather interesting question. I think this goes to all three of you. If you are advising civil servants, would you be recommending they use AI for literature reviews? And if you had a limited budget, would you invest in a bespoke tool? And if so, which one? So it's kind of trying to put you on the spot. I'm imagining it's going to be a bit trickier than that. But Gemma, you look like you're like it's a.
Yeah, so I have added an answer to that comment, but I will expand on it. It's a really interesting question. I don't think it's a straight yes or no answer, and I realise that's a very academic answer. I think I'd be tempted to lean on the Cochrane guidance or the Cochrane position statement on AI in reviews, and the basic the core message of that Cochrane position statement is if you're going to use AI in reviews, there needs to be some kind of human oversight because the authors need to take responsibility for what's produced. And I think that that's what's, if it is going to be used by civil servants, there does still need to be that human oversight. I've also mentioned in my comment that I think it depends on how the outputs of that AI literature will be used. So what decision making is it going to inform, and what's the risk of harm to the population if the output of the AI output is wrong or incomplete? So yeah, it's an interesting question. I don't have a clear answer. There's a lot of it depends from me.
Anyone else want to comment, Sahila? Daniel, or do you think that's basically it depends? Okay, it depends. Do you think actually this is a bit naughty of me, but as chairman, so things are moving on fast and the versions that were used change rapidly. Do you think that, have you seen any evidence that the changes address some of the issues that you've seen in doing in the Elicit, for example?
How do you mean, Chris? Can you expand on that?
We've got newer versions. The changes you talked about, some of the changes that have happened, and they'll be changing rapidly. We've been looking at Claude as well, and that seemed to have changed quite rapidly. So do you think the changes that are occurring to these models are actually catching up with humans? Catching up with the issues that you've identified?
Maybe, but I am forever a researcher, so I would evaluate that to give you a clear answer.
Okay. Naughty of me to try to move you on there. Would Elicit, this is just, I don't know if you answered this in the chat, but I'll ask, would Elicit argue that you could have used Elicit better?
Yeah, so I think that there's two issues here. I think there is a degree of working with it. You can override all the functions, and I think there is a degree of how you work with it to get the most out of it. The second issue, though, is that the search functionality wasn't great, and it did miss 34 studies. So we could have overridden decisions, overall decisions. We could have worked with it more, but that probably wouldn't have changed the omission of quite a significant portion of eligible material. That said, as I said in my presentation, I think there's a way forward with Elicit where we do the searches and then we feed in the eligible studies and work with Elicit in that sense and get the most out of it that way.
Just scrolling through the chat to see. Yes, Sahila, there's an interesting comment here about the ethical considerations with Grok. So I think you've probably seen it by
Yes.
in the chat. Would
you
like to think about
yeah,
it?
yeah. Thank you, Chris. Yeah, that's a very fair question. And I've briefly mentioned that in my presentation that sometimes we tend to use a generative AI or an LLM tool just because of a good feedback from a colleague or co-worker. So that's one of the examples. And we did consider ethical issues, and we mentioned those in our paper. And Grok was included not as an endorsement, I think, but as a part of comparing widely available tools, because of the known ethical concerns around AI tools, including bias, misinformation, their transparency, data use, and so on. that's why we suggested the output should be cautiously treated and use human quality assurance for any outputs from any large language model tools, not only Grok. Yes, we know some ethical, very recent ethical issues about Grok, but we've got lots of other large language models that's got ethical issues and biases as well. So yes, we are aware of that, and we've mentioned that in our paper to make our evaluation quite neutral and not endorsing any sort of tools in particular. Thank you.
Completely understand. There's a couple of questions about Elicit. So in a sense, this could go to both Daniel and Gemma, basically asking why Elicit? Why choose Elicit over other models? Maybe.
Yeah, thank you, Chris. Well, Elicit has put itself out as evidence synthesis like accelerator tool, and there's been growing interest in evaluating it. So you can there are like, I think almost every month there's a new paper coming out evaluating different parts of Elicit. So I think my study only talked about data extraction, and I found 4 studies that looked at data extraction. But I know there are other studies that looked at search, that like what Gemma has also talked about, looking at the whole entire report generation. And so I think that was where the interest came from. I know there are other tools out there. Like, I'm not too sure if Claude, ChatGPT, those are more generic tools, not designed for research. But I know there are research tools like Terra, I think, and SRA accelerators. So these are also tools that could be evaluated to see if they actually speed up processes, and what is the how hard is it to learn versus like Elicit, and it's easy to pick up. So yeah, things to consider.
Is there any comment from Gemma? I think she answered it in the chat actually.
We were curious. Our colleagues were telling us about Elicit and we thought, oh, let's try it. So very opportunistic, not at all scientifically selected.
So there's a question here about how long did it take to quality assure the AI, and actually it kind of connects to something I noted that you said in your times you had no preparation time, or the preparation time was excluded, and I wondered if you'd like to comment on those 2 issues.
Sorry, what was the question again?
So the question, it was actually to Sahila, and it was about how long did it take to quality assure the AI output. And I was saying, I noticed in your prep,
Yes,
saw that you didn't include preparation time in your time estimates.
So we only included the time that took the large language model tools to literally do the data extraction.
Mm-hmm.
But that's a very useful question. I think it would be useful to also measure the time that we spent on the evaluation of the LLM extracted data.
Yeah,
but yeah, we didn't formally measure those timing.
Thank you. I think we've covered all but one of the questions in the chat. And oh no, hang on. The one I was going to try to finish us on is, should all AI reviewed documents being used in part to inform ministerial briefings or any other policy briefings contain a warning saying that AI has been used? Is the question. And I guess we will all say resoundingly yes. They should have a health warning on AI generated documents. Agreed?
Yes, I think definitely we need to be transparent in terms of using any AI tools in our work. So yeah, definitely transparency is a key.
I agree.
And particularly, I think I'm very against using any sort of confidential documents into any sort of AI tools unless it's a very bespoke and internal tool that still, I think, can leak information. So I tend to only use publicly available policy documents.
Very good point to make.
Yes, yeah.
To ensure confidentiality and non-disclosure of information. Very good point to make. Somebody's asked, I think we're going to all answer yes. Do you think we need a work centre to assess AI tools for this kind of work?
I think so. Yeah, I think with this growing interest in using large language models and generative AI in different applications, including research, I think it's inevitable to not using them. So we need to be prepared. We need to be cautious. We need to ask questions. We need to test a lot in different form of research and different methods, different type of data needs to be tested.
Yeah, I agree. I think that's really important that we do test these things. Look, I think we're coming up to time now, so I think I'll probably want to wrap up unless there's any final comments from any of our speakers. But I'd like to thank Gemma, Sohila and Daniel for such excellent talks. Maintaining the quality that we've come to expect of the HAPRU webinar series. And that's a plug to say that the webinar series is back in the autumn. And so we'll be sending out information about future webinars. Thank you very much, everyone, for your attending. Just a reminder that the recording will be put onto a YouTube site and the future webinars will be put on our events page. So thanks very much, everybody. Time for maybe a quick bite of lunch, or for some people, time maybe to go off to bed in New South Wales. Thanks very much, everyone. Cheerio.